Okay, so talking muscular system and thinking back to just last unit, we learned about the named bones of the body. How many named bones were there again? 206. Okay, anybody have any idea how many muscles? And I'm just strictly talking skeletal muscles here. If it's more than 206 or less, it's significantly more. Okay, it's probably 2, 3, 4 times as many. Okay, the absolute number is not as precise when it comes to skeletal muscles. We have a lot of like very small muscles in places like our fingers and our toes. The number is kind of variable from person to person, kind of like what we learn with bones, when it comes to like sutural bones and sesame bones. But most places, say somewhere in the neighborhood of 650 different skeletal muscles. Now, with that said, you're absolutely not going to have to know all 650 muscles of the body. You're going to have to know a very small fraction of that, but it's still a significant number. Okay. Now, of those 650 different muscles, roughly, most of them are going to span at least one joint, whether that's like, a complex joint like the shoulder or the elbow, or as simple as like, crossing between, the different bones in our fingers. And in many cases, you're going to have attachment sites on those two individual bones that form the joint, or if there's multiple bones forming a joint, multiple bones. Okay. When a muscle contracts, one bone remains fairly stationary while the other one moves. Okay. And so we can describe a muscle as kind of having 3 parts: the origin, insertion, and then the belly body gaster, what all are the same thing. Down at the bottom, we have an illustration showing you 2 different muscles, the biceps and triceps. A lot of people know very fondly about those muscles. Okay. The fleshy middle part of a muscle is just the belly, also goes by the body or the gaster. You can see it's labeled here for both the biceps and the triceps. The origin, or in this case, origins, is the point of attachment, or in that case, point of attachments that does not move when the muscle contracts. Okay, in the case of the biceps and the triceps, they have multiple heads, so they have multiple origins. Not all muscles have multiple origins. Okay, in the case of these 2 muscles, they do. Okay, so in other words, we're talking the tendons that are not moving as far as the joint goes, whereas the insertion, which happens to be down across the elbow, is the one that's going to do the moving. Okay, so the insertion is point attachment, or in some cases attachments, that moves when the muscle contracts. So whenever muscles contract, generally the insertion moves towards the origin. Okay. And it's not always proximal for the origin, distal for the insertion. Sometimes it's not that case, but a lot of times it is. Now, when muscles act, they generally do not do so individually. Rather, they act as groups. And what we see in many places that muscles are arranged in what we call opposing or antagonistic pairs at joints. For example, you have flexors and extensors doing the opposite of one another. In the case of the biceps and triceps, that's an example where the biceps is a flexor, triceps is an extensor. We also have, examples like adductors, abductors. And the muscle that's directly performing the specific movement, whatever that movement is what we call the prime mover or the agonist. Okay, and that movement or motion that's being performed is what we call the action or the function. So, we've got a pretty straight elbow, and let's say we're gonna, bend the elbow, so we're gonna flex the elbow. The biceps would be the prime mover. Okay, while that is the prime mover, the triceps is the antagonist. The muscle is directly opposing the agonist. In other words, the triceps is the prime mover of elbow extension, but it opposes elbow flexion. So reading through the next sentence here, if antagonists are relaxed while the agonists are contracted, movement of a joint occurs. So in other words, the antagonist must be relaxed for motion to occur in the prime mover. Okay. If they're both contracted at the same time, they just cancel each other out. Okay, so if antagonists are contracted while the agonists are contracted, no net movement of a joint occurs. Now, sometimes a prime mover crosses other joints before it reaches the joint at which its primary action occurs. And your biceps is a great example of that. Your biceps actually originates on the scapula. Okay, and so it comes actually above the shoulder joint. but its main motion is not associated with the shoulder. Its main motion is associated with the elbow. Okay. So we have synergists, which are muscles that contract at the same time as the prime mover in order to facilitate the prime mover in order to produce a more effective movement. Okay. The word synergy is something you may have seen or heard of before. And that is a term you hear a lot in like corporate settings, you know, like businesses like to say we need to promote synergy. Basically, it's kind of just like a buzzword that means like working together as a team. So being efficient or effective is what synergists do. Okay, what they're specifically going to do is contract and stabilize intermediate joints, so they would be, you know, stabilizing the shoulder joint and are generally located close to the prime mover. Fixators contract and stabilize the origin of the prime mover in order to maintain joint stability, posture, and balance while the prime mover is working. They can steady the proximal end of a limb while movement occurs at the distal end. So, you know, for example, you know, on our shoulders and back, we have like the trapezius muscle, for example, that's attached to the scapula. And what they help do is like prevent, you know, like if you're lifting something heavy, doing a really, you know, heavy bicep curl, you know, the pull of that bicep, you want to pull the scapula up over the top of your shoulder. Obviously, that's not what happens, and that would be obviously awful. So fixators help prevent that from happening. Now, under different conditions, or in other words, under different movements and at different times, many muscles may act as prime movers, antagonists, synergists, or fixators. So, you know, thinking bicep curl, the biceps is the prime mover, triceps is the antagonist. Well, when you relax your elbow back down to extension, your triceps is contracting, so it's the prime mover, while the biceps is the antagonist. In our free limbs, a compartment is a group of skeletal muscles. They're associated blood vessels and associated nerves, all of which have a common function. You know, we have what we call, for example, the flexor compartment muscles, the extensor compartment muscles. I really should change the way that this is worded. Flexor compartment muscles are generally anterior, the exception being like in your thighs, okay? And that's because your knees bend backwards, whereas your elbows bend forward, right? So your flexors of the knee are your hamstrings, and those are in the back of your leg. And then the extensors are your quads, and those are on the front side. So not always are they posterior, anterior, but in most cases they are. As far as this image goes, not an important one. You're going to have plenty others to worry about for the exam. Okay, a couple more slides on just kind of background information on skeletal muscles before we can really start identifying them. Just like we learned with bones, muscles have a distinctive shape and can be classified into different categories based on their shape. So recalling from our previous lecture, skeletal muscle fibers or cells within a muscle are arranged in bundles known as fascicles. So a fascicle, remember, is that second level of organization that, you know, when I did that flow chart, all the fibers are inside of fascicles, and the fibers within a fascicle run parallel to one another. Okay. But with regards to a muscle, fascicles may form patterns with respect to tendons. When you look at these illustrations, you can kind of see the lines drawn in them. Those are illustrating the direction that the fascicles are running. Okay. And this is important because it affects the muscle's power and range of motion. So how much motion that joint will be able to perform when that muscle contracts. The most common type of muscle, and I would highlight that phrase, would be illustrated here, a parallel muscle, which is just a strap-like muscle with basically all the fascicles running parallel. And essentially the muscle is the same width all the way across. Example, that would be the sartorius, which actually is our longest muscle. It's in our thigh. We'll see that later on today. You can probably figure out what we call the next category, triangular. A little more sophisticated term is convergent, but they are muscles that have fascicles radiating from a small to a wide point of attachment. And your pec major, your big chest muscle is an example of that. And chest muscles, we have 2 of those. Pinnate muscles, there's 3 types, uni, bi, and multi-pinnate. Okay, hopefully you know those prefixes by now. Uni means 1. So in the case of unipinnate, they have fascicles anchored to only one side of the connective tissue shaft. So essentially the tendon kind of extends to one side, and then the fascicles radiate out from it. In your calf, we have a soleus muscle. That is an example. Bipinnate always to me look like a feather with kind of a quill like in the middle, and then the fascicles radiating out on both sides from it. So that's why it's bi, it's got kind of 2 sides. And then multipinnate have numerous interconnecting quill-like fascicles converging on a common point of attachment, which will be right here. Your deltoid, which is a big rounded shoulder muscle, is an example of that. Fusiform have fascicles that are close to the belly of the muscle but converge to a tendon at one or both ends. So it looks fairly similar to parallel muscles, except basically it kind of balloons out in the middle, so it kind of looks like an elongated football. Your example there would be the brachioradialis. And then probably the most obvious named is circular muscles, also go by the term orbicular or sphincter, which are going to be found around body tubes or openings. So like what's illustrated here, I can tell you just because I can recognize it, is the orbicularis oculi. Any idea where that would be around? Your eyes, absolutely. Okay, and then the external anal sphincter, which is at the very other end of the body, that's the one that helps you not poop your pants. So very different, but very important. So as far as those pictures go, maybe a good idea to be able to recognize the shape to go along with, the category. So, be able to recognize, for example, this is convergent or triangular, this is parallel, etc. All right, and then finally, we'll talk here about how muscles are named, which will then lead us into being able to identify them for the remainder of the lecture. All right, so several different features can be used when naming muscles. First of all, location, where it's at in the body can be used. So thinking back to our very first lecture in our very first class period, and we looked at the lady from the front and the back, and all those fancy terms were labeled. I told you guys at that time those names would be important, obviously, for that first exam, but for the entirety of the semester. Here's an example of why that's important. Okay, based on its name, the brachialis should be able to easily identify where you're going to find that muscle. And that will be where? Your upper arm, which is your brachial region. Okay. If you think back at that time when we went through those, I told everybody to point to your biceps muscle. Then I said point to your other one, but don't point to your other arm. And that's because the biceps brachii is that muscle in your upper arm, whereas the biceps femoris is a muscle in your thigh, in your femoral region. Okay, you're going to see femoris a lot here, and those are all muscles in the thigh, as we'll find out. Function, what it does is often used to describe a muscle. Adductor magnus, that's one of the muscles that helps you like cross your legs. It adducts your thigh. Flexor carpi ulnaris, it flexes carpi for your wrist. Guess what bone it's nearby? Your ulna. Okay. The shape of the muscle can be used for naming. Now this is going to be a little bit trickier because most of these terms obviously are not rooted Englishly, if that's a word, but instead by Latin, like in the case of deltoid, which means triangular. The direction in which the muscle fibers are running can be used in the case of like the rectus femoris. That's a muscle that is running straight, because that's what rectus means. The fibers are running straight, that is, and then that's in your femoral region. The number of heads, in other words, origins or divisions, can be used, like in the case of the biceps, triceps that we saw earlier today, and I've already mentioned. Bi means 2, tri means three, and then seps means head. So biceps has two heads or two origins, triceps has three. Okay. The points of attachment, as far as origin insertion, can be used, like in the case of sternocleidomastoid, which has an origin on the sternum and clavicle and inserts on the mastoid process, which remember is that bump behind your ear. That's a big muscle in your neck that we'll see several times. I love that word, sternocleidomastoid. It's fun to say. And then the muscle size can be used, as in like the three butt muscles, your gluteus maximus, which is the biggest, gluteus minimus, which is the smallest, and then the gluteus minimus is intermediate in size. So biggest, smallest, and then somewhere in the middle. And then longest, obviously that's pretty common sense. Hopefully is going to mean long, like in the adductor longus. Brevis means short, like the peroneus brevis, which is obviously short muscle. So those are all terms or ways to name muscles. So as you go through and have to identify them on your exam, and you come across some of these names, hopefully you can use those indicators to kind of figure out where things are at if you don't automatically already know. So what we're going to do for the remainder of the lecture is start identifying the various muscles of the body. Once again, remember, I'm not going to require you to know all 650 different muscles or whatever the actual number really is, but it's going to be still a significant number. We'll start here looking anatomical position from the front side at superficial muscles. And when I say superficial muscles, I mean, these are the muscles as far as just pretty much deep to the skin. Okay, so the skin's been removed. But in the case of skeletal muscles and their arrangement in the body, there's many places where it's similar to lasagna. And what do I mean by that? There's layers. Okay, so in this case, we can see what's on the outside, this most superficial layer of the muscles, where in some cases we can peel that layer off to show a muscle underneath, and maybe sometimes you can see another layer is underneath of that. Okay, so we might be looking at some much deeper views. We definitely will be. Okay, this is just a straight on anterior superficial view, and then on the next page is a superficial posterior view. What we'll do, aside from look at them at different depths, is also we're going to like zoom in at the head. We're going to zoom in at the upper arm, the forearm, look at the hand. So we're going to make sure that we can see some of these very small muscles much more intricately than what you can see. Okay, so with that said, let's start doing the fun stuff, which is highlighting, starring, whatever you want to do. I'll start with the first one listed here, but what I want you to know is just the second half of the word, the frontalis. So that's all I would want you to highlight for that. That's a muscle that helps you like raise your eyebrows when you're surprised or skeptical. The orbicularis oris surrounds your mouth. The platysma. Now I'm going to say latissimus dorsi, but don't highlight it because that's a back muscle. It does insert here in your armpit. It does have an attachment site there, but you can't really see it, and you'll really get a good view of it on the next page. Rectus abdominis, I do want you to know. Brachioradialis, external oblique, my favorite muscle to say, the tensor fascia lata. I'll say with a little pizzazz. The iliacus, the psoas major, the adductor longus, sartorius, gracilis, some quad muscles, vastus lateralis, rectus femoris, vastus medialis. They all share the same tendon, which is the next one. I usually just call it the quad tendon. You can highlight the whole thing, or you can write off on the side there, quadriceps tendon or quad tendon. And then the gastrocnemius and the soleus, those are on the back of the leg, but you can't see them in the anterior view. So go ahead and highlight them. Okay, on top of the skull, there is a kind of flattened tendon structure that I want you to know called the epicranial aponeurosis. The side of your head is temporalis. Orbicularis oculi, surround your eyes. Masseter, very important chewing muscle. There's that sternocleidomastoid that we just mentioned. Trapezius, the deltoid, pec major, serratus anterior, biceps brachii. Must skip the next two, but we'll see those in various pictures. Pronator teres, brachioradialis again on this side. Now, flexor carpi radialis. We'll look at some of these other ones. The forearm and the hands get kind of tricky. I do want you to know the iliotibial tract. If you've ever heard of your IT bands, that's what that is. IT, short for iliotibial. Patellar ligament. If you want, it might not be a bad idea. Put in parentheses. Most people call that the patellar tendon. So if you want to write tendon out. And then the tibialis anterior. Okay, moving to the posterior view. Same structure we just saw. The epicranial aponeurosis is a kind of flat tendon-like structure. Then the next one, I'm going to have you rewrite that, and I'm going to zoom ahead to show you how I want you to write it out. So you wrote out, or you highlighted frontalis. In the back, I want you to write it out as this, the occipitalis. It's essentially one muscle connected by that epicranial aponeurosis, but they're so far spread apart that I just kind of separate them from each other completely. So back here is the occipitalis. And then you get a good view of the trapezius, deltoid again, brachialis that we mentioned a little bit ago, triceps, and there's the three different parts to it. You can see there's three different things labeled. Down in the forearm, what do I want you to highlight? Let's highlight the extensor carpi ulnaris, the flexor carpi ulnaris. Down in the calf, the gastrocnemius, the soleus, calcaneal tendon, we call our Achilles. On the right side, essentially everything from sternocleidomastoid down would be fair game. Some of them are a little trickier to see. Like I'll be honest, I would never ask you to label the brachioradialis here in the posterior view. So if you want, you can skip that one, but pretty much the rest of them you can see and are fair game. And like I said, we're going to spend the next 21 slides looking at these things much more in depth and zoomed in so that you can see them a lot better. Now, when I go through these various muscles, generally I either give you kind of information at the top of the page or the bottom of the page as far as like what that muscle does. Notice here we've got 4 muscles. These all move your tongue. Your tongue itself is it's a muscle. Like internal muscles, what we call intrinsic muscles of the tongue, help you like to change the shape of the tongue, like if you can roll your tongue. Whereas these muscles move the tongue around, up and down, help you to form words, help you to swallow, that kind of stuff. Down at the bottom, and I have these kind of similar tables on most of our slides. These are all from your textbook, giving you where the name of that muscle comes from. Like you can see, glossus is all part of the 4 muscles, which means tongue. Then you got origin, insertion, what its action is, so what it does, and then who innervates it as far as nerves go. In these cases, these are going to be cranial nerves, and that's why you see Roman numerals. For a lot of schools, I know like K-State, where I went to school, Washburn, I imagine they do the same. They require students not only to know and be able to identify these muscles, but to know things like origin, insertion, action, innervation. But I am not going to make you guys do that. And I hammer you guys with the bones, and you guys know that. We just got done talking about bones and all those different things like the styloid process. greater, lesser tubercles, the trochanters, all that different stuff that you had to learn. And that's because, a lot of the muscles originate or insert on those different things. And so I feel like I hammer you there. I can kind of take it a little bit easier on you now. And for most of my students, you guys are wanting to be nurses. Not everybody, but most nurses don't need to know where the genioglossus originates. So it's not pertinent to most professions. Now, if you want to be a chiropractor or a physical therapist, this is stuff that's going to be more in your wheelhouse. But you'll learn it when you go into those specialty schools. So for now, you can just kind of ignore that. So we're just mainly highlighting and identifying the pictures. Now, with that said, these four muscles in this picture, I'm going to tell you right now, will not be on your exam. And there are some pictures and some muscles that I'm just going to kind of present, but I'm not going to ask you to know. And these are some of those muscles. Now, the muscles here on the next couple slides, though, absolutely you will want to know. Most of these slides, there are no blanks to fill in. So you'll have to kind of remind me if there is. I know there is, what, 1 or 2 blanks on this page you need to fill in? Yeah. So I just need to take all the blanks out. So talking about muscles that are associated with your face and skull, which are fairly unique. And I really should not just say fairly, they are very unique compared to most of our muscles. Most of our skeletal muscles attach to bones. Okay, they've got an insertion origin on 2 separate bones, and they move joints. Well, in the case of our facial muscles, they are going to be located within the subcutaneous layer, and they usually originate in the fascia or skull bones and insert into the skin. And when they contract, that's what they pull on, and thus they move the skin instead of a joint to make you smile and frown and to raise your eyebrows and to make you do all those fancy fun things that you can do with your face in order to, do things like nonverbal communication. Now, there are some muscles like these 4 at the bottom that are very important for moving your joints to enable you to chew. The word mastication is just a fancy word for chewing, and there are 4 principal muscles associated with that act. Very important act. We can see not all of them here in the illustration, but we can see 3 of them, okay? The temporalis and then the 2 pterygoids. What's missing is the masseter, and that's because this is a fairly deep view. What we've done is actually removed that zygomatic arch. The zygomatic process, remember, is part of the temporal bone. That's that bridge that we've talked about. They've actually cut part of the zygomatic bone, and that gives you a better view of the pterygoids, which are deep to that. We've also cut off the temporalis right there, which is a muscle that, we've actually talked about before. If you think back to when I told you guys to feel on the side of your head, bite down, you can feel that muscle contract. That muscle comes down and attaches to the mandible, okay? The 4th muscle that is not visible, a very important cheek muscle, is your masseter. If you put your hands on your cheeks and you bite down, you'll feel that muscle contracting. But it basically covers all this stuff up, so that's why it's not shown, okay? Now, the temporalis and the masseter are more specific to allow your mandible to come up and down. When they contract, they pull the mandible up, whereas the 2 pterygoids, the laterals and the medial, they're going to help with like opening, protruding, and then moving the mandible side to side, so allowing you to kind of grind your teeth sideways. What we can also see in this illustration are a couple other muscles associated with like moving your lips. So not so much important for like chewing, but very important for, like making sounds, making your lips into a puckered position so you can smooch on somebody. Or in the case of like your buccinator, very, very important in babies because it helps with sucking on the nipple for nursing. So whether that's a actual nipple from a breastfeeding mother or from a baby bottle, and that helps them with swallowing, okay, or I should say suckling. So both the buccinator and the orbicularis oris are helping to do those different things with the lips and kissing and that kind of stuff. So I do want you to highlight some stuff in this image the temporalis, the medial pterygoid there on the left side, lateral pterygoid there on the right side, and then those two muscles, buccinator and the oris, that are labeled invisible. What we'll see here on the next page is just a little bit of the buccinator because the masseter is covering it up. And so here we get a good view of some of those other muscles that were listed, but we also have the neck. So I'm going to include some muscles there that I want you to highlight as well. So we'll start on the left side. Here's the following things that I want you to know. The epicranial aponeurosis, the flat tendon-like structure that connects the two parts of the occipital frontalis. Temporalis, now not cut. We can see it very nicely. Once again, I want you to know it in the back of your skull as the occipitalis. So if you want to write that out, would be a good idea. The masseter is the next muscle that's listed that I want you to know, although I really hate where they've put the line, because all of this is the muscle as well. So to me, it makes sense if you move the lines kind of in the center of it. Gives you a good feel for where that muscle is. Okay, next muscle I want you to highlight is the sternocleidomastoid, which once again, it's not a facial muscle, but since we've got the neck, we can see it. I want you to know it. Same thing for the trapezius and the levator scapulae. We'll see those a little bit more here in the next several slides. The front side here of the face and skull, I want you to highlight the frontalis, the orbicularis oculi, which you don't want to confuse with the orbicularis oris. It's easy to remember. Oculi surrounds your eye. Okay. That's not the muscle that like opened your eyelids. That muscle helps you like with squinting, by the way. Okay. Next muscles I want you to know are the zygomaticus minor and the zygomaticus major. Those are going to help you with like smiling. Okay. And from the research I did, I believe it's the zygomaticus major that in some people is kind of got a unique attachment that causes some people when they smile to have what in their cheeks? Dimples. Okay. Next muscle I want you to know is the buccinator. Once again, that's that important muscle we mentioned on the previous page that we don't get a great view of, but it is there. Orbicularis oris again. And then the platysma. Now, if I go back a couple slides to this picture, the platysma was labeled here on the right side of the neck, but it's not shown on the left. Does that mean there's only one that's on the right side? No, your platysma is kind of unique in that it's a muscle that's really almost like it's in the subcutaneous layer. So it's almost like it's attached and in the skin. Remember, the subcutaneous layer is not in the skin, but like when a dissection occurs and the skin is removed, a lot of times the platysma is removed along with the skin. So this is an illustration that actually includes one of the two platysmas, but you'll see a lot of times pictures and models don't even have the platysma included. So that's why I wanted to mention that. Okay, down to our anterior views. And I say views because on the right side of the face, it's a superficial view. Whereas on the left, they've removed several muscles. We can see some of the more internal ones. Most of the same things that we just saw, which I highlight again, the epicranial aponeurosis, the frontalis, temporalis, orbicularis oculi, zygomaticus minor and major, and the platysma. Then on the right side of the image, left side of the face, I'm going to mention this, but I don't want you to highlight levator palpebrae superioris. That's the muscle that actually allows you to open your eyes. That elevates or levates. Palpebrae is just a fancy word for eyelid. And superioris, it's opening your upper eyelid. Okay, we'll see that. We're going to look at eyes and muscles of the eyes later on the semester. So we'll not worry about that one quite yet. So you've got plenty of others to worry about. So you can skip on down to the buccinator, the masseter, orbicularis oris, and the sternocleidomastoid again. Okay, down into the muscles of the thorax. Now, when I say thorax, I mean the thoracic cage, which thinking back to our last unit, we learned the sternum, the ribs, and then the thoracic vertebrae help to form this thoracic cage and thus our thoracic cavity. What we have are the two sets of intercostal muscles and the diaphragm. There's something to fill in on this page, right? Okay. These muscles are very involved with breathing. So very, very important muscles. Most notably, we've talked a little bit about this before. Remember the diaphragm we learned is the divider between the thoracic and abdominal pelvic cavities. Well, not only does it divide those cavities, but it's a muscle that helps us breathe. It's the prime mover of inhalation or inspiration. So right now, as you guys are just sitting there relaxed and breathing, in a resting state, your diaphragm's contracting. In a relaxed state, it's kind of in this dome shape, but when it contracts, it pulls itself downward and flattens itself out. And that's what draws air into your lungs. Okay. Now, if you take a deep breath, what you're going to do is recruit your intercostal muscles, specifically the external intercostals allow you to take a deep breath in. And if you huff and puff and blow a house down like the big bad wolf, you're going to use your internal intercostals. Okay. Now, I don't necessarily love this image. And this is an image from a different textbook. That's why it looks a little bit different, not quite as crisp and clean as what you saw on the previous page. Okay. Remember the prefix inter means between, costal, fancy word for ribs. So that's where these ribs are located. Your internal intercostals are going to be located next to the sternum. Okay. And why I don't like this image, because it only shows two, whereas they're going to be between all these different ribs. Okay. Your external intercostals are farther away. They're more to the lateral sides of your thoracic cavity and farther away from your sternum as a result. And you guys like to eat ribs out there, like barbecue ribs, pork ribs, beef ribs. Guess what muscles you're eating when you eat ribs?
Oh, I don't very much.
Why?
I don't know. I was thinking about being on the What
Delicious.
is it?
Ribs are intercostals. What you're eating are the intercostal muscles of a pig or from a cow if you eat beef ribs, which ribs are delicious. So as far as what I want you to know from the image, is just the intercostals here at the top and then the diaphragm down here at the bottom. Don't worry about the central tendon. The diaphragm is really cool. Aside from helping us breathe, it's got a lot of holes in it. For example, these like blood vessels, as you can see here, like the aorta, the inferior vena cava, I actually have to go through it. So does the esophagus, the tube that carries food to your stomach. So there's holes in it that allow different things to pass through. Obviously, that was a very deep image. What we see here on the very next page is a much more superficial view in that same general area, but we also kind of extend down into the abdomen, and we even have a right upper arm. So we'll look at some shoulder and upper arm muscles as well. And I do know there is a blank or two to fill in on this page, so I'll give you a second to do that. Okay, so looking here, we've got the chest, the right upper arm, and then muscles of the abdominal pelvic area. They're going to move your abdominal wall, what we commonly call our abs, okay, along with some others. So here's what you need to highlight. We'll start up on the top left with the deltoid, very nice and visible, highlight it. Same thing for the pectoralis major and the biceps brachii, okay. Now the latissimus dorsi, remember that's a big back muscle. We saw it on that first image. I told you not to worry about it from the anterior view. So it's the muscle that we talk about and know, but not here. Serratus anterior, you can see it here, but you can also see it probably a little bit better here on the other side of the page where the arm's been removed. It gets its name because it's kind of like a serrated knife. Everybody knows what a serrated knife looks like? The type of knife that has like the jagged teeth, and that's kind of what you see here. People that are super lean and muscular, they raise their arms. You can see into their armpit area. You can kind of see that jagged tooth-like appearance to the serratus anterior. Now, the next muscle that's labeled is the rectus abdominis, but what I actually want you to highlight is what we call the rectus sheath. And that's because here on the right side of their belly, that's really what's being labeled here. That white connective tissue is the rectus sheath. I believe that might have been one of the things that you had to write down. Okay. It's an aponeurosis, so it's kind of a flat tendon-like structure, and it's of the external oblique, internal oblique, and transverse abdominis muscles that enclose the rectus abdominis. Okay. So we'll worry about highlighting the rectus abdominis over here, where the left rectus sheath's been removed. Okay. Next structure I want you to highlight is the linea alba. This is a thick connective tissue structure that runs right down the middle of those two rectus muscles from our xiphoid process of the sternum down to the pubic symphysis between our hip bones. Okay. So it's a line, and that's probably where its name comes from, called the linea alba. External oblique is what we commonly call like our love handle area of our body. You can see the direction in which those muscle fibers are running. It's kind of a diagonal line, whereas like the rectus abdominis, those muscles run pretty much just straight up and down. The transverse or transversus abdominis, deep to the rectus, they run horizontal. So that's where this oblique term comes from for both external and internal. The fibers are running diagonally. The last structure I want you to highlight here on the left side is this superficial inguinal ring, which is the opening to what we call the inguinal canal. The inguinal canal is a canal, so it's an opening or tube-like opening that runs through the bottom of your abdomen, and it enables, it's very important more so in males, okay, it enables a connection between the abdominal pelvic cavity and the scrotum. In fact, before a boy is born, typically what has to happen is the testes, which actually don't originate in the scrotum, they come down from kind of around the bladder area through this canal and then matriculate down into the scrotum. Okay. And even after birth and for the rest of the remainder of their life, there are still connections that run from those testes up through this canal. For example, the vas deferens, this structure called the spermatic cord. We'll see all that stuff later in the semester. It's fairly common, not super common, but for one or both of the testes to actually not descend down. So like one of the first things I do, obviously it's not like cutting the cord and then they check. So, you know, it's within the first day or so, but they check to find it, you know, both testes have descended down into the scrotum. Because like I said, it does happen where one or both don't descend down, and that could be a big issue for boys. I know that because I have two boys and I remember them checking. Okay, on the right side of the image, they're not labeled, but you can see those intercostal muscles that we just talked about. I'm not going to worry about you drawing them in since they're not labeled, but I do want you to highlight the serratus anterior. Like I said, probably better to show it over here. Highlight the external oblique, but note that in parentheses it's been cut, and that gives us a view of some of these more internal muscles. Highlight the tendinous intersections. Those are the horizontal lines. The linea alba runs vertical, the tendinous intersections runs horizontal, and together with the rectus abdominis, which is the next thing I want you to highlight, those create our six-pack or eight-pack that I know we all have if we were to take off our shirts, and which obviously I'm not going to ask you to do. Next muscle that I want you to highlight, you can only see a little bit of it, is the transverse or transversus abdominis. If you can look hard enough, you can see the direction that those lines are running is horizontal. That's where the name transversus abdominis comes from. The rectus runs vertically, the transverse runs horizontally. And then I also want you to highlight the internal oblique, which is deep to the external oblique. Now we'll see a fairly similar image to this in a couple slides with some of these same things labeled. So you'll have that to look forward to, but not quite yet. Here on the next page, we have muscles that are describing association with the shoulder girdle. Remember, the shoulder girdle includes your scapula and your clavicle. Okay, we've got a pretty deep anterior view, an even deeper anterior view on the left side of the chest. to show some of these muscles off. Back here or over here on the right is a posterior view. This is like your upper back. This is your superficial side. The scapula would be right here. The trapezius covers up all these other muscles. So over on this side, that muscle has been removed, and that gives you a view of the levator scapulae and the two rhomboids, which are going to be attached to the scapula, would be like right here, and they act on the scapula. Listed here on the table at the bottom, we've got anterior thoracic muscles, posterior thoracic muscles. Some of them we've seen already, like the serratus anterior, the trapezius. Some of those are visible up atop with like the levator scapulae and the two rhomboids. As far as these images go, I'm not going to worry about those for the exam. We've got a couple images here in the next couple pages where we'll see those things a little bit better, and it's a little bit easier to identify what's going on in the picture. Anything on this page to fill in? Okay, so aside from those muscles in the kind of upper back, we've got muscles down here in the much lower part of the back to look at. This is a figure from your textbook. It's not my favorite image. In fact, it really kind of drives me nuts because they've basically removed on both sides your trapezius muscle. I say basically, it has absolutely been removed. Okay, they didn't include the traps at all, which if we go back to this picture, your trapezius muscles are obviously very important upper back, shoulder type muscles. Okay, but they cover up a lot of these others, and along with the deltoid, you can't see some of them. So in this picture, the trapezius has been removed from both sides. The deltoid is included just on one side. Okay, and some of these muscles, like the levator scapulae, have been cut. So there's some good things to this image. There's some bad things, but I want you to highlight the image nonetheless. So what you need to know from this image is the deltoid, the teres major, latissimus dorsi, your big lat muscles. That's, you can see, much more visible than what you saw when you looked at the front side, where you can just see a little bit of it. On the right side of the image, the levator scapulae, even though it's been cut, that's a muscle that's going to help elevate your scapula, hence the name. Rhomboid minor, which is smaller than the rhomboid major. You're going to want to know both of those. The supraspinatus, which sits in that supraspinous fossa above the spine. Below the spine is the much larger infraspinatus. And then, not to be confused as the teres major, but is the teres minor. Those three muscles, you can see they're all going to attach right there around the head of the humerus. Those three are going to be part of what we call a rotator cuff, and we'll look at that on the next page. So infraspinatus, teres minor, rhomboid major, teres major again is the much larger version of the teres muscles. It's not a rotator cuff muscle. The two heads of the triceps that are visible, lateral head, long head, I don't really care about any of that lateral long head stuff. So just triceps is perfectly fine. And then the connective tissue here, that's kind of a diamond shaped, associated with your lat muscles. I want you to highlight as the thoracolumbar fascia, excuse me. And it attaches down there to your sacrum and hip bone, so your pelvis, as well as your vertebrae above that. Okay, let's talk about the rotator cuff and look at those specifically here on the next page. Fancy term for your rotator cuff is the musculotendinous cuff. It includes those three muscles that we just saw, but then a fourth that was not visible, which is called the subscapularis. And you can only see the subscapularis if you're looking in the anterior view. Okay, it's a very deep view. So this is the scapula, obviously. This is the front of the scapula, and then covering that up is the subscapularis. So you can see that, highlight it there, highlight the supraspinatus as well. Over on the right is a deep view from the back side, just like what you basically could see here on the previous page. where you can see the other three, supra, infra, and teres minor. Very nicely. All four of those muscles kind of congregate up here towards the head of the humerus. And that's their job, is to keep the humerus in its head in that socket. Okay? And so that helps really reinforce the glenohumeral joint that we previously learned about. Now down here at the bottom of the page is in my opinion, a superior image to the one that was on that previous page. Now we've included the head, so nothing has been cut, whereas like above, the levator scapulae was cut like right here. We actually have the trapezius included on the left side. So we've got a superficial view on the left, a deeper view where that's been removed along with the lats on the right side. So I like this image a lot. Wink, wink. Okay, so here's what you need to highlight. Sternocleidomastoid again for like the 5th time. Trapezius. Deltoid. Now the next 3 are labeled here, but if you look across, they're labeled over on the right side. And to me, it's a little easier to tell them apart. Infra, teres minor, teres major. You can highlight them here and here, or you can highlight them just on one side. I wouldn't ask you to label on both sides. If I put this image on the test. The latissimus dorsi. The external oblique. And then on the right side, everything from levator scapulae on down, I would highlight. Now, a couple things that aren't labeled that you might want to draw in, like right here where the white-ish gray area is that thoracolumbar fascia. So you might want to draw that in and label it. And then they didn't label the triceps like they did on the previous page. So it might not be a bad idea here on the left side. It's not this muscle, it's this one. It's the triceps. Any questions so far? We're cooking pretty quick here through this, so if I'm getting too fast, don't hesitate to slow me down. Okay, let's talk about muscles that move our vertebral column, what we collectively call the erector spinae muscles, which tell you exactly what they do. They help keep your spine erected, so they help with keeping your vertebrae running up and down, keeping your vertebrae in the correct alignment. Includes the iliocostalis, longissimus, and spinalis groups. So they're mainly responsible for extension of the backbone, erecting it. They can also affect flexion, so like bending over, and then lateral flexion, like tilting to one side, and even with rotational motions. Okay. Most of these muscles are very long strap-like muscles that basically just run vertically up the spine. What they've done in this illustration, you can see these little things that are like probes that are kind of help separating them from one another. To me, these muscles are some of the hardest to kind of tell apart. And I'll tell you right now, you don't need to worry about them for the exam.
So if you're missing any of these muscles, that means that you could possibly have that.
I wouldn't say like some people will be missing them. You might have like muscle imbalance, or like one's stronger than the other, and that's why it pulls a little bit harder. As far as affecting and causing things like scoliosis and that kind of stuff, it might also just be the way that the body was formed and put together. It might not be a muscle issue, but more of a bony issue. But that'd be kind of my guess. I don't know specifics on it. I'm not a doctor, unfortunately. I can give my best guess a lot of times, but not always is it probably right guess. Okay, basically looking here on this next page, we've got muscles that move the humerus. So we're talking basically motion that's occurring at the shoulder. Okay. And we've got some muscles that we've talked about and seen several different slides now listed at the bottom. And what we have is kind of the same version of this picture or in other words, just a different view of what you saw here. So a lot of those same things. I like this image quite a bit as well. Kind of like that one we just saw for the back. So highlighting this one, platysma again, deltoid again. Notice they've got 3 lines pointing to the pectoralis major. And all of that you see here on the right side of the chest is the pec major, because this is the superficial view. Okay. Keep in mind, it's very common for students to kind of think maybe this is the pec minor. You cannot see the pec major, or excuse me, you cannot see the pec minor superficially. You have to get the pec major completely removed because the pec minor is internal. So pec minor is one of the muscles that you're going to have to highlight, only visible in the deep view. Okay. Same things is what we've seen several times. Serratus anterior. Might not be a bad idea to label the biceps brachii, since it's not, but it's visible there. I like the abs down here where you can kind of see through the rectus sheath, but you can also see like the linea alba real nice. So highlight that. External obliques, nice and visible. That rectus sheath is nice and visible. Superficial inguinal ring is nice and visible. On the right side, pretty much everything would be fair game, I would say. We get a nice view of the pec minor. We even see those intercostal muscles again. What's not labeled, remember these horizontal lines? We learned those a little bit ago. Might not be a bad idea to label those as tendinous intersections. Okay, so I decided to put that picture on there instead of this one where it's actually labeled. Okay, so those are muscles of the abs that you can see, but also, you know, these ones here in the table, or tables, because there's 2, are going to help with like moving the shoulders. Okay. When we talk about muscles moving the forearm, we're talking about motion at the elbow. So flexion, extension, but also pronation and supination. And the names for those muscles are pretty darn straightforward. Okay, we've got a couple different views here. This is a lateral view, so it's not labeled, but this is like looking at the side of your arm. Get a nice view of the delt, triceps, biceps. In between them is the brachialis, not to be confused with the brachioradialis, which if you go down here, the brachialis basically is strictly an upper arm muscle. It does insert down here past the elbow on the radius. Whereas the brachioradialis, it's much more of a forearm muscle. Okay, most of the muscles located distal to the elbow. So that's why the brachialis is named brachialis, because it's mainly in the brachial region. Brachioradialis runs alongside the radius, and thus is more of a forearm muscle. Okay. Over here, this is an anterior view. It's not labeled as such, but this is the front of your upper arm, where you get a nice view of the 2 heads to the biceps connected to that coracoid of our scapula. You get a little bit of a view of the brachialis. I really like the illustration here to show the pronator teres. The pronator teres helps pronate the forearm and hand, aids in flexion of the hand. That muscle, not to be confused with the pronator quadratus, is up there by the elbow. Pronator quadratus is more down there by the wrist. Those help, remember, pull your palms to the back posteriorly. Okay. As far as these images go, I'm not going to ask you to know them for the exam. We've got several other views where we can see these same things. And then we've got a couple pictures here on the next couple slides zoomed in at the forearm. Speaking of the forearm, this is, in my opinion, where things get really complicated, because what you're going to see is in the forearm, you're going to have a lot of long, skinny muscles that work on your wrist to flex, to extend. What we literally are going to kind of focus in on those 6 muscles. But you're also going to find a lot of other muscles that work like the fingers and work the hand. Okay. So you're going to see we've got 3 anterior views, superficial, intermediate, and a deep view. Posterior, superficial, posterior, deep view. A lot of the muscles pretty similar. I'm going to break it down into just a few muscles that I want you to know for the exam. Okay. And actually, all I'm going to worry about for the exam is the anterior superficial view and the posterior superficial view. So out of the 5 views here that you have on this page, just 2 of them will be what I want you to know. So going to the superficial view, or excuse me, the anterior view, here's what I want you to highlight. I'm going to start with the pronator teres, which we saw a couple slides ago, as well as the brachioradialis that we saw. Remember, if you can use your thumb and pinky to help you, this is going to be very helpful. Okay, the radius is which side, thumb or pinky? Thumb. Okay, and that's where you're going to find the brachioradialis because it's on the thumb side, runs all the way down the radius. Okay, the next 3 that are listed here, the palmaris longus, flexor carpi radialis, flexor carpi ulnaris, are the 3 wrist flexors. So those are going to help you flex your wrist. Okay, the flexor carpi radialis, it starts medially at the elbow, but then it comes across, and along with that, brachioradialis runs alongside the radius, whereas the flexor carpi ulnaris starts medial and runs entirely medial along the pinky side, alongside the ulna. And then the palmaris longus is just in between them. Okay. Now, located down at the wrist, coming across like a Band-Aid, I want you to highlight what we call the flexor retinaculum. Okay. Look at all these tendons that are running deep to that flexor retinaculum. That flexor retinaculum kind of helps hold those tendons close to the wrist. Okay, if you remember, we talked about the carpal tunnel previously. Okay, the flexor retinaculum creates that carpal tunnel along with the curvature of your wrist bones. Okay, don't worry about the palmar aponeurosis or anything down here in the hand, at least quite yet. The pronator quadratus is labeled, but you can't really see it, so you don't really need to worry about it there. Moving to the posterior view, the first muscle I want you to highlight is the extensor carpi radialis longus. So this is going to be a long muscle, hence the name longus. And it's going to run all the way down the thumb side. That's why it's called the radialis. Okay, and that's this muscle all the way down here. And from there, I want you to skip down and highlight the extensor carpi ulnaris, which is going to run more to the pinky side, hence the name ulnaris. And then the extensor carpi radialis brevis. You guys remember what brevis means? Short. Obvious, opposite of longus, brevis is short. Okay. So the 2 extensor carpi radialis muscles, the longest, the brevis, along with the extensor carpi ulnaris, help with extending the elbow or extending the wrist, excuse me. Okay. We do get a good view of the flexor carpi ulnaris here in the posterior view, so I want you to highlight it. And then just like on the anterior side of the wrist, on the posterior side is a thick band of connective tissue kind of helping to hold the tendons in place. This one is called the extensor retinaculum. Okay, now here's where things get fairly complicated into the hand. We have sets of muscles that move the fingers. We can kind of break down the muscles of your hand to what we call the thenar muscles, which are on the lateral aspect of the palm. So those are the ones over here on the thumb side. The thenar muscles are the only ones that I'm going to actually want you to know. Then you got the hypothenars that are on the medial aspect over on the pinky side, and then in between would be the intermediate or mid-palmar muscles. Okay. A lot of these are very small. Okay, we can see a example of some tendon sheaths that we talked about previously in our last lecture. What I want you to know is just these four pollicis muscles. The word pollicis is short for pollex, and pollex is a fancy word for your thumb. Okay, these muscles help to move your thumb and do the different things that their name implies. Opponents, that's the one that helps you, like touch your other fingers, perform that opposition. Abductor abducts, flexor flexes. Okay, this is the illustration from your textbook. Okay, over here on the right is a different version of that same image, essentially, but with the abductor cut, which gives you a better view of the flexor and the opponents. Okay, and then you can also see the adductor, which I forgot to mention there as well. I don't want you to know this image though, just this one will be the one I want you to know for the exam. Okay, so that's it for the upper body. Moving down to the other side of the body, we have what we call the perineum, a diamond-shaped area inferior to the pelvic diaphragm, extends from the pubic symphysis. Remember, that's the piece of cartilage between your two hip bones. That's anterior. And then the coccyx posterior, your tailbone. And then the ischial tuberosities, which is the bony parts that we sit on. Okay, so there's the diamond. In other words, it's like your pelvic floor. Okay, you may have heard of the perineum before, but this includes the female's vagina and the anus, and men would be the penis and the anus. So that general area of the body, which nobody likes to think or talk about. Okay, these muscles are arranged in 2 layers, superficial and deep, and are going to help with urination, ejaculation in males, urination, compression of the vagina in females. You ever heard the term Kegel muscles before? That's what a lot of these muscles are, helping with various reproductive things and whatnot. As far as the exam goes, I'm not going to worry about these 2 images. There's just a lot going on. There's some very small, intricate stuff, and we'll look at the perineum a little bit more when we talk about the vagina and the penis. Very end of the semester. So we'll move on from there to now talking about muscles that move the thigh. In other words, when we say move the thigh, we're talking about at the hip joint. Okay, a collection of muscles that come together are what we call the iliopsoas. That includes the iliacus and psoas major muscles that share the same tendon. The psoas minor sometimes gets thrown in as well. Those are kind of collectively what we call our hip flexors. The tensor fascia lata is on the kind of lateral side of the thigh, helps to flex it, but also abduct it as well. This is just kind of a zoom in at the thigh and then up into the lower back. I'm not going to worry about that image because we can see those same muscles again here on the next page, along with some of the other muscles of the thigh. Okay, looking up at the top of the page, we have 2 different images, neither of which is labeled as far as what you're seeing. This is an anterior superficial view, so it might not be a bad idea to label that because this is the image that I want you to know for the exam. What you can see in this image includes those 3 muscles that I talked about on the previous page, the psoas minor, iliacus, psoas major, that collectively form what we call the iliopsoas, which I want you to highlight. Those are the hip flexors. Okay. You can also see the tensor fascia lata. Like I said earlier, my favorite muscle to say. Highlight that, as well as the iliotibial tract. That's the IT band, as most people like to describe it as. Thick connective tissue associated with the tensor fascia lata. Okay. Here down in the lower part of the upper leg, here's the patella. We can see the quad muscles, but not all of them. Quad is a term or prefix that means 4, but we can only see 3 of the muscles. The 4th muscle, you actually have to remove the rectus femoris to see it. It's deep. That muscle that's missing here in this image is the intermedius, the vastus intermedius. These are the 4 muscles that are most responsible for extending the leg at the knee joint. Okay, so they keep a straight leg. Okay, they also are going to help with doing a little bit of hip flexion. They're not the main hip flexors; those are the iliopsoas. But I do want you to know the vastus lateralis, rectus femoris, vastus medialis. Okay. You're also going to have to draw in 2 things, and those are the quad and the patellar tendons. Okay, if you see where my cursor is right here, this white band, and the key is it's above the patella, is the quadriceps tendon. Whereas down here below the patella, this white band is the patellar tendon. Whereas sometimes you'll see it like earlier in the lecture, patellar ligament. So above quad, below patella. Patellar. It's basically the same structure. It's just got the patella in between it. Okay. So essentially your quads connect to your tibial tuberosity by way of those 2 tendons and the patella in between. Okay. I also want you to highlight, aside from the iliopsoas muscles, the adductor longus, the gracilis. Your longus, I always call this a seatbelt muscle because that's what it reminds me of, a seatbelt coming across your chest. The sartorius. So you should have highlighted everything in this image with the exception of the anterior superior leg spine and the pectineus. I'm not going to worry about. Well, unfortunately, we can't see in this image are the other 2 adductor muscles, the brevis and the magnus, which those 3 muscles help with adducting the thigh, so helping to like cross your legs. They also help with a little bit of flexing the hip as well. Okay, so this is what's on the front side of your upper leg. On the back side, starting up by your hips, will be your 3 big butt muscles, the glutes, gluteus maximus, the biggest, the smallest is the smallest is the minimus, and then the intermediate size one is the medius. I don't care about you knowing these 3 images, because we'll look at the muscles here on this next page. Is there anything to label on this page or to highlight, to fill in, I should say? Okay, so what we're going to focus in on this page, aside from those glute muscles, will be the hamstrings. Okay, 3 separate muscles that are all very important for flexing the leg at the knee joint, so performing knee flexion, but they also help with extension of the thigh, along with those big glute muscles. Your glutes are the very, very important hip extensors, very important because they keep your legs straight and keep you upright walking, and that's why humans can walk on 2 legs bipedally, as I described that. All right, your biceps, just like the biceps brachii has 2 heads, a long head and a short head. Then semitendinosus and semimembranosus are the 3 hamstrings. Okay, looking at our image, we can see those labeled here in the picture. This is a posterior view. Very nice. Show the long head. Very hard to show the short head though, so I wouldn't really worry about the short head. And if you really want to, you can kind of move the arrow up here, the line up here. This is all the long head of the biceps femoris. That's on the lateral side. On the medial side are the other 2 hamstrings, the semitendinosus and the semimembranosus. Keep in mind, it makes it look like the way that it's labeled that the membranosus is like 2 separate muscles or 2 parts. Okay, it's just because the tendinosus is superficial and it's skinny, so it's just like a fat muscle down here, and so it looks like there's 2 parts. So if you go back here, you can kind of see how much fatter the membranosus is versus the tendinosus. And so don't think that the membranosus is 2 separate muscles. It's just one, but you can see it. kind of two spots there. Aside from highlighting those three muscles, the tendinosus, the membranosus, and then the long head of the femoris, I want you to highlight the adductor magnus. We talked about that just a couple of slides ago. Up on the top right, the gluteus medius, gluteus maximus. What we cannot see, and that's because the maximus is covering it up, is the minimus. Okay. I do want you to highlight, because you can see a little bit of it, the tensor fascia lata. This is really the best view, unless you're looking just from the lateral side of the leg to see the iliotibial tract, what we call the IT band. Don't worry about the lateralis, because that's really not that visible. I do want you to highlight the gastrocnemius, because we're going to look at that on the next page. And then I want you to draw in and label this diamond-shaped area where there's like nothing. That's the back of your knee. And that's called the popliteal fossa. Popliteal fossa. And the popliteal region is the back of your knee. The fossa is just the depression where there's nothing really there as far as muscles go. There is stuff there. Just a lot of vascularization, a lot of arteries and veins. Okay, kind of the same situation as what we saw in the forearm. We've got a lot of long, skinny muscles in the lower leg. And these muscles are going to move the ankle, but some of them move the feet and your toes. And I'm going to break it down to really three muscles. There's a fourth one, the tibialis posterior, that's listed. And that's because it's prime mover of foot inversion. Remember, that's where like the bottom of your foot can roll inward. But I'm not even going to worry about you identifying that because it's really deep and it's only visible in this far right image. The three other images are all superficial, and those are the three that I want you to know. Okay. First muscle I want you to highlight, you can see it here in all three images, is the gastrocnemius. There's a medial head, a long head, or a medial lateral head. You know, you can see there's two big heads to it. I don't really care about medial lateral head, just gastroc. This is the very important plantar flexor of our ankle, so helping you to go into tiptoes, okay? Along with some other muscles, it shares a tendon called the calcaneal or Achilles tendon that we've seen before that I want you to highlight. You can see it here in the lateral view as well as the posterior view. Can't see it in the anterior view because it's on the back of the ankle, okay? Your gastroc is a very powerful muscle. So like basketball players that can jump really high, they're going to have big calves because of this gastroc. Your soleus, which is deep to that muscle, and I want you to highlight that here. Soleus sits deep to the gastroc, so that's why kind of the same thing. Looks like there's two muscles, but that's just because it's deep to the gastroc. Your soleus is more of a muscle that you use like when you're just standing around. So it's not nearly as powerful. It's more fatigue resistant though, so it's a postural muscle. And then the final muscle that I want you to know is the tibialis anterior. You can see it here, anterior and lateral views. You can't see it on the back, and that's because it's on the front. Tibialis anterior. This is a very important muscle because it's the prime mover of dorsiflexion. So like picking your toes up off the ground, going back on your heels. And so you just have to know these three muscles and then the calcaneal tendon. I will keep it mentioned real quick. Keep in mind, it's not shown here, but there's like a V-shaped connective tissue that covers the top of your ankle, kind of like what we saw at the wrist, what we call the superior and the inferior extensor retinaculum. I don't know why they don't include it in the image or any of the images, but those are thickened connective tissues that help hold the tendons in place. And like I said, the tibialis posterior is a important muscle because it helps with foot inversion, but you have to cut away a lot of muscles to see it. So it's just too difficult to really show it off. All right, and then finally, the bottom of your foot is what we'll look at here, and muscles that help us flex your toes. Okay, to curl your toes. along with a very important connective tissue called the plantar aponeurosis or plantar fascia. Okay. Of the two images, this is the only one I really want you to know. It is a superficial and deep view, which sounds kind of backwards, but I'll explain why that is. I'll start by talking about the plantar aponeurosis, which I want you to highlight. Notice in parentheses it's been cut. Okay. This connective tissue would cover up basically all this muscle. It runs from your heel bone and runs all the way towards your toes, covers the bottom of your foot. Any of you ever heard of plantar fasciitis before? That's where this has become inflamed pain that people experience with that condition. Okay. So it's been cut so that we can see the flexor digitorum brevis that I want you to highlight, this big muscle here. That's going to curl your 4 small toes, and then highlight the flexor hallucis brevis, which is going to curl your big toe. The halix is a fancy term for big toe, so that's where that term hallucis comes from. Don't care about the plantar deep view, or you can see quite a bit of muscles as well, but not going to ask you to know it. So just the 3 things here in the left image: the flexor hallucis brevis, flexor digitorum brevis, plantar aponeurosis. Okay, any questions?